Hello, Dallas. It's time to wake up and get wealthy. I'm Terri Arends, Group Fitness Wellness Director with the Arends Family JCC. And today our topic is going to be on a topic that is totally underrated.
Yeah.
Sleep. All right. So let's get comfortable and have a little discussion here. Dr. Oholendt, thank you so much for coming on the show today. I really appreciate it.
Thank you so much for having me.
And I know that you are an MD and you have a lot of experience and knowledge and expertise in many subjects, but today we're going to focus on sleep.
Yeah.
So thank you so much for coming on.
Sure. Thank you so much for having me. I really appreciate it.
Great, great. So, I really feel like to live a healthy lifestyle, to live a healthy, wellness-oriented, day-to-day style of living, that you really need sleep. And in many ways, I feel like sleep is one of these topics that just gets kind of brushed under the carpet.
Yeah.
And that is totally underrated.
Yeah.
So tell me what your thoughts are on sleep and how people can get a little bit more on track with, like, if you were to give me your 5 benefits of sleep, what are those? Let's start there.
I think I really agree with you that sleep is very underrated. And I think when people are trying to lead a healthy and well lifestyle, getting good amounts and restorative sleep is very, very important. So I think in terms of like a couple of takeaways, I would say to say what are the big benefits of sleep. There's actually quite a lot, and a lot of it, they've done studies to find, what is helping people when they sleep well. There's less risk of disease, so less colds, less getting ill during the winter time, less depression, so better mood, better cardiovascular health, so heart health can actually be impacted by sleep. And overall being awake and wakefulness is improved. Cognition or how you think. There's a multitude of benefits of just getting good, healthy sleep.
Well, I love that. Yeah. So you're saying, like, with the benefits, what out of those, like, I think you had more than 5.
Yeah.
So if you had to pick 1 or 2 of those benefits, which ones would you think would be most beneficial?
I think for people at home, I think most of us are really what impacts us day to day is that wakefulness and being able to think well and perform well at home or with the kids or on your job. Doctors, we all like to say, well, it's going to prevent this, it's going to prevent that, but that's down the line, right? So for a lot of people, it's more about just how does this impact my daily life? And I think that's where saying, hey, getting good sleep, you're going to feel better during the day. You're going to feel like it's easier to do the things you need to do well.
Okay.
Yeah.
That makes sense. And so my next question is, we're all different.
Yeah.
And I'll be honest, when I'm in my bedroom and I decide to go to sleep, my head hits the pillow and I'm out.
Oh, you're lucky.
And so I'm lucky. I with the research I've done, I'm figuring, I'm lucky. But anyways, we're all different, but is there like a specific number of hours that everybody should have in order to have a good night's sleep?
So I'd say it ranges. So there's a good range. And most people, it would be recommended to get 6 to 8 hours of sleep. And that's basically anybody from maybe 18 to 21 years old through about 65. Younger than that, so if there's teenagers that are at home, that really probably I'd look more at 8 to 12 hours a night of sleep, to be restorative and healthy. And then as people mature and their age goes up, they are going to have less melatonin around. And so they are going to naturally sleep less. And actually 4 to 6 hours a night may be normal for older adults over 65, basically.
Okay, so I'm going to ask you, how many hours of sleep do you usually get?
Do I usually get?
Yeah, just curious.
I'm usually around 7, and I have a 10-month-old at home, so I've definitely gotten less than that at times during the last 10 months. But usually I feel best when I'm getting at least 7 hours of sleep a night.
For me, it's almost in there. It's about 6.5 to
Mm-hmm,
7,
mm-hmm.
and I just feel like I can rock the day.
Yeah, yeah.
You know,
Yeah,
so
and it's a range. Like and honestly, everybody is different enough that like if people are at home and they're like, well, I feel pretty good if I get 5 hours of sleep.
Mhm.
Nothing's wrong with you,
Oh,
like
okay.
everything's okay. It's just that this is kind of averages and ranges for most people, basically.
And so when somebody that is heading to bed and they put their head on that pillow, um, should they fall? I mean, usually is the norm to like fall asleep like I do real quickly, or does it take some people longer to fall asleep? How does that work?
Yeah, I'd say, like I said, I think you're lucky in terms of maybe a bit of an exception that you just go right to sleep. That's
that.
great.
Yay.
That's great. Love that for you. But most people, it's going to take, some minutes. And really the timing that I would say that we're starting to sit in bed for too long before we fall asleep is probably 20 to 40 minutes, and maybe just say on average 30 minutes. So, somebody that's sitting in bed for longer than 30 minutes with their head on the pillow, actively trying to go to sleep, that's probably a bit too long. Most people, I'd say, are probably somewhere from like 5 to 20 minutes. So that's kind of the ranges again of what's normal.
So let's say that they're having a hard time falling asleep. Is it better to just kind of leave the bedroom or wherever they're sleeping and do something else and then try it again later? Or what's the best strategy there?
So the sleep experts would say that tossing and turning is not good. So I think it's very similar to what you're saying in terms of, and something I tell my patients all the time, if you're sitting in bed for more than 20, 30 minutes and you're not falling asleep, go ahead and get out of bed. And if possible, get out of the bedroom. And I usually tell people to go to kind of a relaxing place in their house or their apartment and do something that kind of helps them to get to a more positive mindset. So, some people that's mindfulness, like meditation. Some people find prayer is, something that helps them. Reading, doing anything that kind of, again, just gets you back to a more positive space so you can go back to the bed and not feel as frustrated or as upset that you're not sleeping.
So basically that would also mean to still stay off your phone, stay off the computer, avoid the TV, all those things. And
and I think, really the reasoning behind that, and so just going backwards a little bit, let's say an hour before bed, I really do recommend just basic sleep hygiene to turn off screens around an hour before your bedtime. And then same, if you are having trouble sleeping, you get out of bed, not having screens as a part of that. And really the science behind that is just the blue light from screens, from computers, from phones, from TVs, all that stuff is going to tell your brain that it's time to be awake. And it's kind of counterproductive to the purpose of that.
Nice.
Yeah.
So when we are discussing sleep, do you feel like that, is it really true? I mean, do people like sleep the whole night through, or how does that like play out? Because they'll say like a good night's sleep and you sleep the whole night through, but but I must be fortunate. But what about the other folks out there?
I'd say it's pretty normal for most people not to necessarily sleep, dead solid, that 6 to 8 hours. So having 1 or 2 nighttime awakenings, for most people, it's to get up to go to the bathroom, I think would still constitute a healthy sleep. Having more frequent awakenings through the night, especially conscious awakenings, I think probably is going to impair sleep quality. And so that would maybe be something, if that's happening to someone, I'd say, well, maybe we should talk about what's happening through the night that you're waking up, having a hard time going back, or you're waking up so frequently.
Yeah. So like with those sleep cycles that you're talking about, I guess some folks will, is there a way to turn your brain off? I know that sounds like a really crazy question, but like that may be like a situation where somebody can't fall asleep because they're thinking about what they need to do the next day or the next week, or they're preparing for whatever they're preparing for.
Yeah, I mean, I think going back to what we first talked about in terms of trying to bring your head to a more positive space is probably the best way we know to turn your brain off. The sleep cycles happen naturally. Your brain is going to do that when you do finally hit the point of sleep. And there's basically 3 non-REM cycles that you go through and 1 REM cycle. And it is important to try and get all of those, because the REM is kind of where the brain actually repairs itself. That is probably the most linked with improved cognition and thinking through the day. But yeah, in terms of trying to get to that point of actually getting to those sleep stages, it really is, I think, a little bit of a battle against your mind, against yourself, I guess, in terms of trying to find that peace in order to really fully get to sleep.
So I must plug in here that here at the J for 2023, we have some really awesome special event pop-up programming going to happen. So some mindfulness is going to be happening. Also, we're going to be doing a meditation in our silky hammocks.
Yeah, cool.
So where people will just be a float kind of meditation, and we'll have headphones that will cancel out, the noise, and we'll just hear the person that's providing the meditation and so forth.
That's great.
If they came to a program like that, where then they're pretty much relaxed and then they have to drive to get home, is that going to interrupt? I mean, should they go to bed right away, or is it just the mindset that they take from the program that will assist them later in falling asleep?
I think it's more the latter, because really when it kind of getting down into the mindfulness weeds, I guess, mindfulness and meditation, or again, people can practice mindfulness doing anything. You can walk and practice mindfulness. You could eat and practice mindfulness. So doing meditation right before bed sounds helpful to me, just on par. But we know that just thinking about trying to lessen anxiety, which is a common reason that people have a hard time sleeping. Even just doing 2 minutes a day of mindfulness at any point through the day can improve anxiety. Does that necessarily improve sleep? Maybe. But I mean, it just sounds like it should. So I think that for people, maybe there's some importance of when exactly you do it. I don't think anybody knows. Probably more the important thing is just trying to build a healthy habit around that mindfulness and stress reduction to try and help people sleep better and not have the brain turned on right before you're trying to go to sleep.
Well, and this is a great month to be talking about mindfulness, because a lot of times mindfulness and gratefulness, we're closing down the year and preparing for the following year. So, these are really good tips too, just on the whole mindfulness, which is a part of wellness.
Just in everything. Yes, absolutely.
And in regards to those sleep cycles, and if we does it work if I take a nap, let's say in the middle of the day, and it's a 20-minute power nap, not here at the J, and then later I get home and I take another nap, and so maybe that's like an hour's worth of napping, and then I only need 6.5 hours of sleep. So should I subtract that from the 6.5? So does that mean I only need 5 hours and I'm ready for the next day? Or do those naps really, constitute for that solid 6-8 hours, whatever somebody needs? Does that make sense?
Yeah, I think what you're asking is, if I'm napping during the day, does that count towards my total, or is it just extra?
Exactly.
You're kind of stumbling onto the sleep specialists kind of talk about different types of sleep phases. So you think about, usually here in America, most of us sleep from X time at night, and we sleep 6 to 8 hours through the night. But then you think about other cultures like Spain, for instance, where you sleep maybe 5 to 6 hours at night, and then they sleep for about 60 to 90 minutes during their siesta. And so that really is monophasic sleep, is what they call it, versus biphasic sleep. So 2 sleep phases versus 1. The short answer on that question is that we don't really know which one is better. They've never been proven one to be better than the other. So, I think here in America and just in our culture, it's much more normal to sleep all in one phase. And so you're just going to fit in more to daily life, I guess. But going back, I guess, to the question of, hey, do my naps add? Do they break?
Exactly.
I think that it's hard to say. I guess I'm kind of equivocating on a lot of the questions, but we do know that naps can be healthy, especially what you mentioned as a power nap. So a 15 to 20, at the most, probably 25-minute nap, done earlier in the day. So probably before 3 or 4 p.m. at the latest. And again, very, very short interval. Now that has been proven to help people think better, improve cognition, wakefulness. So those little power naps. But again, keeping them early in the day, not having them be close to sleep time, and not having them be longer intervals is how you really kind of can, I guess, master the power nap.
I see. So basically, if I took a power nap later in the evening and then I decide to go to sleep, it's going to disrupt my sleep.
It may make it harder to get to sleep, basically. Yeah.
So, okay, there's a lot of buzz out there about creating your sleep sanctuary. Can you talk to us a little bit about that, and also give us maybe some tips on how to create such a place?
Absolutely. So I think that a sleep sanctuary, like a sanctuary, sounds peaceful. So really the basic of that is just creating a peaceful environment where you sleep. Most people, that's the bedroom. And there's probably just a couple of components that are really proven to be important in a sleep space. Darkness is important. So having, a good amount of dark is really proven to help your body produce that melatonin naturally and tell your body that it's time to go to sleep. Temperature matters. Most people would say that having it a little bit cooler helps to induce sleep a little bit better. Just because if you sleep with a warm room and it works for you doesn't mean there's something wrong with you. But most people, a cool room is going to be helpful. The other thing would be sort of what we talked about before, is removing screens from the bedroom as much as possible. If you use your phone for an alarm, okay, that's fine. But they have sleep modes on phones now where they kind of eliminate the blue light from your kind of start screen, which I think is very helpful. Just really trying to avoid having your bedroom, your sleep sanctuary, be infiltrated by this blue light with TVs or phones or things like that. So I think those 3 things would probably be like a good basic. So temperature, light, and then lack of screens. Temperature, light, and lack of screens. The 3 big ones to create that. What about are there any, not that we're advertising mattresses, but there's a lot of different mattresses out there now that do a lot of different things, from coolness to comfort. Is there anything to that too, as far as with the whole sanctuary piece? Or I think if individual people find that is helpful for them, that's okay. I wouldn't say that I go recommending, hey, you must get a cool mattress, you must get XYZ. Maybe some of that is mostly advertising. Okay, like DAC. Exactly. Hey, we love DAC. That's fine. Exactly. Love that one. Exactly. Yes. So those 3 are the big things in order to create that sanctuary and get that good night's sleep. Yeah, absolutely. I love it. I love it. I'm going to go back and, back to my house and kind of think, oh, do I need like a darker, maybe some a darker blind, something kind of thicker to block out that light at night, the street light. So I wanted to do this little game here. Okay. All right. So it's going to be myth versus facts. Okay. And some of the things we've already covered. But, and of course, explain away. But here, are you ready for this game? I'm ready. I'm excited. Here we go. All right. So, all right. Yeah. Do we have a buzzer now? Is more sleep better? Short answer, yes. I think that some people may feel a little bit groggy after they do a big sleep, but that could just be, I'd say in most instances, people are trying to catch up on weekends, for instance. So
Mhm.
don't sleep as much as they should during the week, and then sleep a large amount, like 12 hours on a weekend. And I would say most sleep experts would say that actually doesn't make you feel better and doesn't improve wakefulness. So yes, within reason, but I think probably it's more important, and the fact would be that it's good to have a consistent sleep schedule and really trying to get that 6 to 8 hours a night on a consistent basis, as opposed to, oh, well, I slept 12 to 14 hours one night, I must be fine the rest of the week.
Right,
Yeah,
right. Do
yeah,
the math there.
yeah.
Yeah. Okay, I know we already talked about this one, but does your brain shut down? I guess you can just recap during
Yeah.
sleep.
Yeah, so the brain doesn't shut down during sleep. So, we talked about there are the 4 sleep cycles, the 3 non-REM, and then the REM sleep, the REM being the most important for kind of repairing your brain. So the brain is very active at night, but it's active towards improvement, I guess, or repair. And we talked a little bit about really the fact is the best way to turn off your brain before it gets to that sleep point is really some of that mindfulness, creating a peaceful environment, doing things that ground you and kind of help you be at peace before going to bed.
Okay, so now this one's close to my heart. Myth
Okay.
or fact? Exercise at night interrupts sleep.
So short answer would be no. Longer answer would be it probably depends on how close to bedtime you do it. So it depends. If you're somebody that likes to go to bed at 9 o'clock, say, I would say probably try not to schedule exercise later than 7. So most of the sleep experts would say good sleep hygiene means having about 2 hours between your exercise and your sleep time.
Okay, and then we talked about, and just to recap again, I'm in bed and I can't get to sleep. Should I stay there or get up? And just to, again.
So the fact would be getting out of bed if you are not sleeping for more than about 20 to 30 minutes is really what's recommended. And getting out of bed, getting out of the bedroom if you can, and going to somewhere that's, again, peaceful in your house or apartment, and doing something that really helps you get your mind off of things. If you're thinking about work, if you're thinking about your day the next day, what's going on with the kids or your family, really just trying to, we talked a little bit about mindfulness, be mindful with something, whether that's meditation, prayer, journaling, reading, any non-screen activity of your choice, you get to choose from, and do it for 20 to 30 minutes, then try getting back in bed.
Okay. And to recap this as well, what would be like 3 points that would determine if I'm a good sleeper?
So I think that probably the most important thing would be how you feel after you wake up. People should not feel really, really groggy for more than a couple of minutes after they wake up. They shouldn't have headaches or feel tired throughout the day. So how you feel is very important. I think general wellness. So, if you are finding that you're struggling with weight, if you're finding that you're struggling with blood pressure or other diseases, looking at sleep is important. It's something that I think, I'm a primary care doctor, and I probably overlook it in the office a lot. But it really should be a fundamental for everybody to be well and healthy. So I'd say really how you feel, and then thinking about just, okay, well, where is my overall health at? And if it's not where I'd like it to be, maybe I should look at sleep as a part of, meeting with my doctor, trying to get exercise, trying to eat right, all of those kind of elements of a healthy lifestyle.
Right. Those pillars of wellness there. So definitely remember to keep sleep as one of those. Like if we have 5 pillars of wellness, it's definitely one.
Yeah. And like you said, underrated, overlooked probably.
Yes. Yes. Anything else that you'd like to share with our viewers on this topic?
Yeah.
today?
I mean, I think that sleep is something that is, like you said, underrated. It's not talked about enough. And I think that the focus a lot of times is more on passive activities that we do to try and get sleep. Take a pill, for instance. But I think that I'd like viewers to more focus on active strategies to get good sleep. Again, we talked about peaceful environments, creating your sleep sanctuary. If you're not sleeping, things to do to get out of bed and help yourself get to sleep. And I think that if they're doing those things and they're still finding that sleep is an issue, there are a large amount of sleep-related conditions out there. And before reaching for a pill or an over-the-counter supplement, if they have a primary care doctor, I would say go reach out to them and say, how can I maybe get better sleep? And they can maybe screen for some of those conditions like sleep apnea, restless leg syndrome, and tell them if that's something they need to be worrying about or treating to get better sleep.
Okay.
Yeah.
All right. Well, viewers, thanks again for tuning in. And until next time, remember to wake up and get wealthy. I'm Terri Arends. Bye.